Hello, friends. I'm Shikhar, your host for the new startups. And today, with me, I have Ilan, founder and CEO of Amai Proteins, a new company that we are bringing on the show. And Amai is doing very good with respect to the new proteins that are coming up in the market, and they are trying to replace the sugar. But rather than I give you more about it, I'll invite Ilan to tell something about him and about Amai Proteins.
Thank you, Shikar. Happy to be hosted by you. Appreciate the invitation. I opened my 8 years ago after 18 years in academia. After teaching biology, chemistry, and computer science, I have a pretty unique and multidisciplinary background. I taught biology, chemistry, and computer science. I founded and chaired what became the main meeting in computational structural biology. And after publishing what became the main book in the field of computational protein design, a field that just in October David Baker got a Nobel Prize for it, I decided to quit academia and to open Amai to make designer proteins for the mass food market.
And Elaine, can you also tell us how you got the idea to start Amai Proteins and what was the key thought of bringing this new innovation in market?
So I should go back 50 years ago when I was 2 years old, and my twin sister became wide, I became tall, and she actually ate less than I did. Her metabolism is better, and she consumes the calories in a better way and stores them as fat, while I ate a lot and was over slim. I could go and eat ice cream only when I went to the doctor, and only even then I couldn't tell my sister, which is not big fun to not to tell your twin sister about an ice cream you had. So I became quite obsessed with sugar. And during my career, as I led a meeting, international main meeting on computational structural biology, I knew that there are hypersweet proteins. During my PhD, I worked on photosynthesis and how I succeeded to design it to work in higher temperatures, a photosynthetic reaction center, and I postdoc with a guy who invented the field of protein design. But then I figured out that most people are doing their own thing, and very few people, a lot of people are talking about it, but very few people are walking the walk and not just talking the talk. And I began as an former intelligence officer to look what others have done. Out of that came a review, annual reviews of physical chemistry, and a book called Computational Protein Design, 85,000 downloads. And there I understood in page 83 that very few people were successful in doing it. And after being the first one to critically look on the different designer proteins, proteins made by design, I understood that I can do it. And then my academic career was not interesting because I understood that I can take a hypersweet protein, which is something amazing. You have six hypersweet proteins in different fruits in the jungles from Malaysia and China to West Africa. And they are unlike all other sweeteners, which are small molecules. And after you swallow them, they continue to be sweeteners, continue to activate your sweet receptor that lines your gut, continue to change your microbiome, cause a pre-diabetic response, be digested by the liver, excreted by the kidneys. Proteins are not like that because at the end of the day, we are a protein machine and all proteins are a necklace of beads called amino acids. And once our body sees a protein, we very quickly digest it to amino acids. So I thought proteins are good for you. And if we have hypersweet proteins, let's use them because they are sweeteners in the mouth, but once you swallow them, they're very quickly digested and they're no longer sweeteners, so they're not expected to have adverse effects with the human body. So with that
Excellent.
idea, I quit academia. My parents and many others thought I'm totally nuts because I had a good career. And I could open the company within the Weizmann Institute or Angels, but I decided to go for the Strauss Group government private incubator where their partners were PepsiCo and Danone. And I thought I want to be product centric and not science centric. Science, I know, I need the product side. And that was 2016, and now we are 8 years later, and we have a product. We just got kosher certificate. We are
Nice.
producing it today in Bangalore in India. looking into establishing production capacity in the Brazil and in the UAE, having already fee-bearing agreements with many of the world's leading food and beverage multinationals. Just got two regulatory approvals in the US and about to get regulatory approvals in Singapore and Israel. And moving forward to making a world that is sweet, delicious, tasty, healthy, and sustainable.
That's excellent. And Ilan, when you are saying that you have already got regulatory approvals in certain countries, where do you want to expand in the next 3 to 5 years? Because this is something that the whole world desires to have.
So we are very global. It took us more time than some other companies. We have 10 patents, submissions, patent applications, proved patents that were spread in 53 countries. We are very, very global. 60% of the diabetic market today is Southeast Asia. For us, I mean, just as an example, Malaysia and Philippines is a bigger market than the US. According to Lancet magazine, looking on where there will be a doubling of diabetes in the countries that suffers the most out of the metabolic syndrome. Those are hot Muslim countries, so we are very much interested in penetrating the hot Muslim countries. We are now moving to sales in the United States, Singapore. Those are the two hallmarks of regulatory approvals, one for the Western world, one for Southeast Asia. And from there, going to additional countries, we began the process in Brazil. And from Brazil, we want to go to the rest of Latin America and definitely looking at our small little blue planet as our market and not in any specific country.
Great. And for our listeners, sweet proteins that we are talking about, these are almost 3,000 times sweeter than a normal sugar. Now, this is quite interesting because you only require a very small quantity that's necessary. And Ian, based upon my limited knowledge, I can say that when we are going to use very small quantities of this protein, there can be some challenge of bulk that is desired in the products. So how do you foresee that the companies that are going to use the proteins, they can compensate for the bulk that is necessary in the food?
So you're absolutely correct. There is no one golden bulletproof solution to replace sugar. There are today, according to Lux Research that gave the best review of the topic, there are 8 categories of sugar reduction. None of them above 30% sugar reduction, which is what is needed for sugar reduction labeling, none of them tick all the check boxes of taste, health, cost, not to mention sustainability. Within the $100 billion market of sweeteners, the 90% is sugar and the rest is many other solutions. And any market where you'll say 90% is controlled by one product, you'll say it's a broken market. We are not going to replace 100% of the sugar. We are actually fit only to about two-thirds of the market, and we don't do sugar elimination, we do sugar reduction. Whether
Hmm.
it is our chocolate, which has no sugar, but two-thirds is us, swilling, and one-third is low intensity sweeteners such as maltitol, erythritol, and so on, or whether it is ketchup, where we do 70% sugar reduction of the added sugar and 30% is still sugar. So instead of
Hmm.
13% added sugar, we have only 4% added sugar. So we do a very significant sugar reduction, but we don't do sugar elimination. Because we are 3,000 times on average, 3,000 times sweeter than sugar, we are also cost efficient and we are not more expensive than sugar in sweetness units. However, while we have an amazing dark chocolate, 50%, 55% cocoa, if we do milk chocolate, which is 50% sugar, we need to add bulking agents. And the bulking agents can be the usual fibers, inulin, chicory fiber, or other fibers, but that may raise the cost. So milk
Yeah.
chocolate, we need the addition of bulking agents, fibers, which will raise the cost. In ketchup, by the way, when we reduce so much sugar, we get liquid ketchup. So we need to put a stabilizer or fibers, it doesn't matter. We definitely don't give the answer to the bulking, and we need to work with other solutions for that. We are also with the first product with Swillen today. We are fit for all pasteurization schemes, but we are not fit for very long boiling or for frying or for bakery. We do have already in the lab new variants, which in the future, I mean, they can do half an hour of 95 degrees and they're still very good. The current one, the first one, is still not there, but what we can do very short boiling and pasteurization. So today we are fit within the $100 billion market to 60%. And even if we do 50% sugar reduction, we have a market of $30 billion. Let's begin there and move on to more things. Last but not least, most of the world, already in 23, World International Bank claimed that 57% of the population is taxed for sugar. Today it's much more.
Yeah.
Already every month, more countries tax against sugar, following the understanding, the consensus that sugar underlies a metabolic syndrome. Metabolic syndrome is diabetes, obesity, non-alcoholic fatty liver disease, epithelial cancers, mental diseases, and much more. And following that, the world is taxed for sugar, and yet there is no solution. But most of the tax is on SSB, on sugar sweetened beverages, and there
Mhm.
we have a very good solution to reduce close to half of the sugar without compromising taste.
Yeah, and this is an excellent point when we are talking about sugar taxes. So, Ilan has given us a very good point that this can be a very good solution where companies can work along with other factors, the bulking agents or whatever is necessary, and can come up with a product that is very close to the original taste of the product. Now, Ian, you definitely gave us some examples like for ketchups, for chocolates, for beverages. Which are the other markets, or holistically, which are the markets that you see where the fermentation designed proteins can be a good solution?
So that's a good question. First of all, any market which sugar is used as a sweetener and not as a bulking solution, and where you don't have prolonged very high temperature, is good for us. Whether it is energy bars, whether it is chewing gum, we have amazing chewing gum with no aspartame, which got a very strong warning from the World Health Organization. We have peanut butter after 50% sugar reduction. Our super taster panel, we have 25 super tasters who come twice a week, and they claim that it was too salty, so we removed 40% of the salt, and then it was too fatty, so we removed 50% of the added fat. So we got peanut butter with less sugar, less salt, and less fat, same great taste. As to the products, in the United States, the first two regulatory approvals which we got are the self-affirmed GRAS, and GRAS is GRAS, generally regarded
Yeah.
as safe, and the FEMA, Flavor Extract Manufacturing Association GRAS, and we are expecting in 2025 to get the FDA approval. In Singapore, we got a general approval. Both the direction is to get both as a novel food and as an additive. With the FEMA grass, we can go to flavors and extracts where you cannot be a sweetener, so it's under sweetness perception of 1.5% sugar. And with a self-affirmed glass, we are focusing on dietary supplements, including gummy bears. We have amazing gummy bears with no added sugar. But the idea is to go with the new regulatory approvals that we expect to get during the upcoming year to go to the general market with a focus on sauces and ketchup. And above all, sugar sweetened beverages is the biggest market, the biggest pain point, the most taxed part of the sugar industry. And we have to remember 180 million tons of sugar. Beverages make a very significant portion of that. Tens of percent of that is sugar sweetened beverages, and that's our biggest market.
Hmm. And then one more thing I would like to understand, and that's very crucial for our consumers. You highlighted a cost benefit when we are going to use it. So I'm sure our listeners would also like to understand, in addition to the cost benefit, what are the other things that they should have in mind while considering this particular technology over the existing alternate sweeteners? Many companies are already using stevia, some are using other extracts, but majorly, what you would like to highlight to them in addition to cost?
So we are 100% protein.
Hmm.
Actually, when I look in the mirror, I don't know what you see when you look in the mirror. When I look in the mirror, I see a protein machine. Many talk about the DNAs, the genomes. The DNA and genome is a book of laws. And it doesn't matter if it's a book of civil law or religious law, the book of law itself is almost meaningless when it's on the shelf. When you open it and read it, that's what's meaningful. And reading and opening it means translating it to proteins. So we are the sum of our proteins. All proteins are made out of the 20 building blocks amino acids. In our body, half are also with sugars, glycosylated. We are only amino acids, nothing but amino acids. We are biomanufactured by yeast in our protein brewery, just like any other protein, and we are digested quickly to amino acids. I'll give you something new. We are just publishing it this week. We just finished the world's first clinical trial. It's a double blind random clinical trial where we gave people, they came every 2 weeks, and one time they got 75 grams of sugar, one time they got a similar amount of sweetness in the same volume of stevia, and one time they got our swelling, very high concentrations. 75 grams of sugar is what you give to pregnant women for diabetic test, pregnancy diabetes test. So it's a very high amount. And we see that we have zero effect on blood glucose and insulin levels. Zero effect. So it's the first time you have a sweetener which has no adverse effects. The World Health Organization in May 23 put out an advisory saying that all high intensity sweeteners, artificial and natural alike, whether it is sucralose, saccharin, sulfam K, stevia, monk fruit, they're not good for you and not much better than sugar, with a special warning against aspartame. Even on the low intensity sweeteners, evidences such as erythritol and others, evidence has come beyond the discomfort to the stomach, bloating and digestive issue, and some get diarrhea. This is a dose dependent issue. There are also other concerns with cardiac issues. We are a protein. So, for the first time, you have a new category of a general use protein, which is actually not bad for you. And it's also very sustainable because it is so potent. 1 kilogram replaces 3 tons of sugar. So
Yeah.
replace a teaspoon of sugar with less than 2 milligrams of the protein. Because it's so potent, also the supply chain is much potent. Today, sugar is grown in a land bigger than the UK. 180 million tons are produced, huge carbon footprint by transportation. Depending on where, but there is an issue of waste management. There is a contamination of air, land, and sea due to pesticides and herbicides. Sugar is a big concern. There is deforestation. There is a larger effect to the lower socioeconomic group, and sugar today is well known to also cause the metabolic syndrome. So we offer a new category of something that will allow you to do significant sugar reduction without compromising taste, health, cost, and sustainability.
That's an excellent point. In addition to health and cost, we can say that the swilling from Amai Proteins is going to bring a highly sustainable option in the market. And this also brings me to a point. We are talking about precision fermentation. You already mentioned that this is synthesized from yeast. I see that sometimes consumers do have a wrong perception. There can be labeling concerns and so on. Any comments on educating the consumers, or if that is necessary to bring it to a mainstream market?
Yes, so some consumers have a concern about genetically modified microorganisms. In our case, it's not genetically modified organisms. Without getting into my personal views on genetically modified GMO topic. Our protein is without any DNA. Part of our COAs, a certificate of analysis, shows that we have no residual DNA. Consequently, the genetically modified microorganism, the yeast that produces the proteins, a swilling product, is considered a processing agent. It is not part of the product. The product is pure protein with a little bit of salts coming from the buffer solution, which are all good for you. And actually, I drink the fermentation immediately when you separate the liquid from the cells. The protein is in the liquid. I taste the liquid directly. It's not different than in beer what you have, so it's all good for you. But in our case, there is no GM part of it. I can compare it to decaf coffee. Decaf coffee, during the process, you use a material which is terrible for you. But this material is not part of the final solution, final product. So consequently, we have no genetically modified part. And according to all the regulatory authorities, and we've checked it in the US and Europe and in Singapore and other places, we do not need to go through the BE, the bioengineered track, simply because we have no GM component in the end product. So we are, for the first time, yes, we are a sweetener. We are a high potency sweetener. We all enjoy the delicious taste of sweet, but because we are digested quickly and we did digestibility studies in the most complex way and show that we are readily digested through amino acids. We also did the clinical trial, so we are a very safe product. And that's also the regulatory agency said, by the way, the clinical trial is not needed for safety. It's just a marketing tool to show the influencers, the endocrinologists, the dietitians that we have something which is indeed very safe.
Excellent. So I would like to convey this to all our listeners as well, that we are talking about a solution that is cost effective, tastes good, is not having any health related concerns, and it can be easily taken up into the market because there are no such type of regulatory concerns or labeling issues. That's how we see it. And on top of it, we are not talking about just any sweetener, we are talking about proteins which are required in very less quantity. Now, this brings me to a point that we see it as a very good solution. And Ilan, if we have to make it mainstream, that every single company out there is using the Swilin, do you see any potential hurdle in front of it for upcoming 2 years or 3 years, which maybe you or the implementers of this technology in their product need to handle?
Yeah, so there are a few challenges, definitely. And as you said, on one hand, I mean, we won the best competitions, the biggest competitions, such as Extreme Tech Challenge, the number one impact competition in the world, 2,000 startups focusing on the 17 United Nations Sustainability Development Goals, market disruption, fitness to market, and team. We came number one out of 2,000. We won Future Food Asia Award. We won Tech Tour in Europe. We won really Ag Funder and many other competitions. We got very good traction from the world's most known multinationals, and yet we are still not in the market. And here there are a few things. Number one, we need regulatory approval. And regulatory approval takes time. There are also different tracks, and some countries rely on other countries and on all kinds of international approvals. And this takes time. We now got the first two, and in the upcoming year, we believe we'll get at least three additional approvals. And within the next 2, 3 years, I hope that in most of the world, we will be able to move. A second part is production and supply chain. We need to produce it in yeast in 100,000 liter fermenters, microbial precision fermentation. We need to build such factories. There is not enough capacity in the world to do it. It obviously needs to be food grade, halal, kosher, with all the certificates, a place approved by the regulatory authorities, FDA and others. We are now raising $100 million as fundraising in order to help us to optimize the production R&D, moving from R&D to production R&D, and also to formulations. We need to optimize in each place. The technoeconomics is a bit different. We can feed the yeast with different carbon sources from glucose, sucrose, glycerol, molasses, you name it.
Mhm.
But for each thing, we need to adapt it. And then there is market education. We are opening a new market. There is market education. Some of the big companies are very conservative. We think that some of the companies are not preparing themselves for the global changes. We have seen, I mean, the world's, in the US, the biggest dairy went bankrupt, Chapter 11, because they didn't fit to the new market. Also today,
Mhm.
some companies don't understand how much sugar tax and education about the fact that sugar is not good for you is affecting the market. And it takes them a very long time till they adapt a new product in the market. We need to show them, obviously, supply chain. So we have a chicken and egg. On one hand, companies want to make sure that 5 years from now we can supply very large amounts. On the other hand, we need the capital in order to do it, and we still don't need the very large amounts. So those are just market education and supply chain and establishing large scale until the big companies will adapt us. You have 13 companies that control half of what we drink and eat. That will take a little bit of time, and in the meanwhile, we're working with also smaller companies in order to get quickly into the market.
That's great and fantastic to know. In terms of timeline, Ilan, what do you see? I mean, in how much time we are going to see it as a mainstream product in the market?
So definitely in 25, we are beginning sales. We are already in the process of launching sales in the United States, followed by Singapore and countries that rely on Singapore to get the regulatory approval. In 25, we expect to get the FDA approval and then move to other countries, including Latin America and Asia Pacific region. With a sales cycle and market adaptation cycle that can span anywhere between 1 to 2 plus years, we believe that it will become a large household thing around 2027. But this all depends on our ability, on one hand, to raise funds and to help.
Mhm.
We found out that we need to help the companies, big and small alike, in formulating it and showing them that, and we have quite a few joint development agreements where we get the product without the sugar and we give it back with a sweetening solution. We teach and do the transfer on what we did, and then the company can take it and tweak it as they want.
Mhm.
Obviously, companies that is a market leader in whatever product knows their product best than anyone else, but they need their consumer studies, they need to check pilot, they need to check shelf life, and so on. So it's a
Yeah.
process that will take 2 3 years, but we believe it will be a major household name in every household around the world.
Great, great. And that's excellent piece of information for us and our listeners. And the last question that I have is from a business angle, so that the companies who are going to watch this should also know what you have in mind. Would you like to take it ahead as a B2C product, or you would like to collaborate with the B2B companies like Ingredion or Cargill's of the globe and then produce it at a scale? What can you tell us about some of the future plans that you have?
Good question. I opened by saying that my motivation is my twin sister when I was a kid, where I felt guilty when I ate sugary stuff, and my twin sister could not have it, despite the fact overall she ate every day less calories than me. My motivation is to go for large volume and to go for every country in the world so every kid will be able to enjoy the delicious taste of sweetness without the guilt and without the damage causing by the sugar. Following that, we have 4 different tracks of market deployment. As a whole, we are a B2C branded B2B product. We don't want to reinvent the wheel. We are not going to be a healthy multinational huge company. We want to go into the value chain wherever it is to sell directly to the 13 huge companies that control most of what we eat, but then to the medium and whoever wants it to go with the integrators, the ones that mix together, blend together the different sweeteners and bulking agents and whatever powders are needed, and to go with distributors and to go with others. We may do as, and then there is a track of flavor and extract, which is an easier track. It's a very small amount of ppm, parts per million amount of product, because we cannot be more than 1.5% sugar perception there, sweetness perception there. And then we may do some B2C market demonstrations to show our ability to go for the market, but we are basically a B2B product and happy to work with different customers. We have fee-bearing evaluation agreements with quite a few big companies I can mention, including grants, including direct agreements. I can mention PepsiCo, Danone, Ocean Spray, but there are many others that I cannot mention. Actually, many of the very well-known names in the beverage and food industry have already worked with us in order to check it and be ready for the regulatory approval and do a quick launch.
Mhm. That's excellent, and this is fantastic information for our viewers. I would like to thank you for joining us today, Ilan, and we'll stay in touch with you in case we have more questions or we have some opportunities coming to us. We would like to connect you with some big companies. And thanks for coming on the show. Thanks for your time.
Thank you. Appreciate you hosting me and appreciate the good questions. And keep following us. We just had a few press releases and about to have another one in the clinical trial this week. Thank you.
Definitely. So, will all the users and listeners who are with us today, please do follow Amai Proteins. It's an excellent solution, and as it's going to be in the market, I believe the purpose, the vision that Ilan shared, it's a huge vision. The diabetic population, the amount of obesity people that we are getting, and the people who are going from metabolic disorders, for all this huge population, it can be an excellent solution.